I'm Dai Chung. Welcome to the In the Know video series. Today we have Dr. Jeannie Kwon, who's Professor of Radiology at UT Southwestern Medical Center and Children's Health, also the Division Chief of Pediatric Radiology Program. Welcome.
Hi, thank you for having me today.
Yeah, I was looking very much forward to our conversation today.
Me too.
There's a lot to discuss when it comes to pediatric radiology. So I'll leave it kind of open to you.
The easy thing to start talking about is AI. Everybody's interested in AI.
Let's jump right in.
One of the benefits of being here with UT Southwestern and Children's is we get to learn and watch what happens on the adult side, and we have access to their resources and their knowledge, and then apply what's useful in the pediatric setting in a safe and effective way. So AI has really helped to accelerate our ability to acquire those high-resolution, high-quality images. So kids are having to lay in the magnet for shorter periods of time. The other benefit of that is that if they're not in there as long, we've been able to also decrease the amount of sedation for a lot of these studies. And some of them, we've decreased the scan time 50% or more. It's been phenomenal. Years from now, it's going to help us be more efficient and be able to synthesize all the data, because there's so much data, as you know. And we need human experts to know what's relevant or not relevant for a given patient.
There's probably not a single patient without getting any imaging or radiological studies, right?
Yes.
So the scope and kind of what you all do day in, day out.
There's so many ways to answer that question. We can talk about the type of patient. So what specialty are they being referred from? And just about every specialty, just about every unit in the hospital. In terms of ages, every age, I mean, starting from fetal, right? Fetal imaging, fetal MR, fetal ultrasound. We could also talk about organ systems, head to toe, brain imaging, and even specific parts of the brain, pituitary imaging. It's hard to say what is not included in the scope of imaging because there's so much, and it does continue to expand as technology expands. Also in nuclear medicine, for example, the tracer. So nuclear medicine is where you have a drug that's injected into the body, and we can target those drugs to certain parts of the body and show us how the body's functioning. We can actually take pictures of tumors now because the isotopes can target the specific tumor. And when they target the tumor, not only is it a picture, but with radiation labeling, it also can provide local radiation to treat the tumor. So we can actually visualize tumor size and tumor response based on the pictures that those drugs are targeting. We see a lot of that in the adult world for prostate cancer, for example. And it's only a matter of time where there will be development of these specific tumor targets for kids as well. And so there's so much evolution.
Yeah, I'm glad you mentioned that example, because radiology, I mean, it's simple to just say radiology division, but what are some other, perhaps different, for example, interventional radiology and a whole host of other things?
We do a lot of fluoroscopy. So fluoroscopy, when I talk to patients and I explain to them what they're about to experience, I say it's like live X-ray. And so with fluoroscopy, we can see, for example, in upper GI series, we can see the swallowing mechanism and the intestines and the stomach and the small bowel and sometimes even the colon. Kids love seeing these things on the screen. Wow, that's my stomach. Oh, that's my drink. And I'll joke, that's your lunch right there. You know, I can see that. So from basic X-ray, fluoroscopy, ultrasound is also something that a lot of people are familiar with. We can do quantitative ultrasound. So ultrasound elastography, for example, is a more modern advanced ultrasound technique to measure the stiffness of the liver, and that gives us an indication of liver disease and fibrosis, cirrhosis, for example. We also do contrast ultrasound, which a lot of people are not familiar with. People think of contrast with CT and MR. I think that's pretty commonly understood. But with ultrasound, the contrast agent is actually bubbles. So we see bubbles circulating. And so we can evaluate focal liver lesions, for example, sometimes with more specificity than with MR. Even with CT, the technology continues to advance, and the hardware is also advancing such that we can use less radiation with higher resolution, sub-millimeter structures like in the inner ear, for example, to see the tiny bones in the ear that conduct sound for hearing. We can see those at fine resolution with lower radiations.
A lot of exciting stuff happening. What does a team look like?
We have about 30 pediatric radiologists, all of them fellowship trained, some of which have multiple subspecialty certifications. So in terms of expertise, we are well qualified and well situated to deliver the best care. Technologists who are trained to acquire specific types of images in the specific setting, and they're absolutely part of the team. They work face-to-face with the patients.
Yeah.
They work to calm them and help them get through the imaging piece because it can be very unfamiliar. And then there is the technical expertise, right? It's not just pushing a button, but knowing how to calibrate the equipment to get the best images.
With all the great work that you and your team are doing, what would you like for the rest of our community to know about what you provide?
Hands down, we have the top expertise in the region and beyond. We have child life team members who are dedicated to radiology. We tailor that experience to the patient and the family, make it very child-friendly. Ultimately, it's the collaboration with our referring physicians, such as yourself. And so being a part of that ecosystem, a team-based approach, I think is what makes it such a fascinating and dynamic place to work.
Now, how many years have you been at Children's Health in UT Southwestern?
This is my 20th year.
God, 20 years. What are you most proud of?
I'm proud to see where Children's and UT Southwestern have come. We are on the map. We are providing as good, if not better care than any other pediatric institution you can think of. We've grown, we've developed, and we've brought in really great expertise, great training. So it's not just people from the outside, but the people that we're building up from the inside. So it's really exciting to see how much of an impact 20 years can make.
Well, thank you so much for spending some time and sharing all the great work that you and your colleagues are doing day in, day out, and we really appreciate you.
Thank you. It's been a pleasure. Thank you for giving me the opportunity to come out of the reading room into the light and share. Yeah,
absolutely.
outside of the basement.
Thanks, Jeannie.
Thank you. Thank you.